My name's Dr. Ashlin Alexander. I'm a facial plastic surgeon in Toronto, Canada. My practice is a mix of facial aesthetic surgery, so rhinoplasty, eyelid surgery, face and neck lift surgery, that sort of thing, and then also hair transplant surgery. And how did I come to that field? It's kind of like not random, but I guess it was, I really liked everything related to the face and facial anatomy, and I knew that I liked surgery, and I liked the idea of like, here's a problem, here's how you fix it. And then life kind of happened, and here we are.
Hi, my name is Caroline Ruggiero. I am the CEO of True Hair and Scalp Clinic here in Mississauga, and I'm a certified trichologist. Trichologist is a hair and scalp specialist, and I suppose I landed in this field somewhat organically. I became part of a family business that was helping women specifically with hair loss, originally due to chemotherapy. But I very quickly became interested in the core or root of the hair loss, pun intended, of hair loss issues. So I went back to school for nutrition first, and then later for trichology. And here I am helping men, women, and children with hair and scalp issues. Dr. Alexander became involved with, I've known of for some time because I was referring patients to that clinic for hair transplant surgery. It's really important to me to connect with professionals that are the best of the best. And so, and that's sort of how this conversation happened. And of course, we get questions in the clinic relating to the hair, but also the face. And so some of these things overlap and are connected. And here we are talking about how we can work together a little bit more.
There's a lot of kind of knowledge to cover. And I think in medicine in particular, for better or for worse, we've become sort of super subspecialized. And so, most of us, we kind of focus on one or two or maybe three very specific areas, and we say, okay, I'm going to be really good at that. And so from a hair standpoint, as a hair transplant surgeon, I said, okay, I'm going to focus on the hair transplant surgery side of things. We certainly, touch on the non-surgical side of things as well, because that's a big part of hair loss, not just restoring hair that's been lost through surgery, but prevention through non-surgical measures. But there's a whole world of kind of scalp health, hair health, that is just outside of what we know. I'm just not an expert in that, and Caroline is. So that's really where we kind of made our connection is, how can we synergistically work together to kind of provide the best care for our patients?
I always like to say that hair is a barometer for what happens within the body. So when people come to me with hair loss issues at various stages, it's usually a sign of some kind of disorder within the body. And even with, very common, cases like androgenetic alopecia, or female, also known as female pattern hair loss or male pattern hair loss, there are so many issues that need to be treated and that are outside of the scope of my practice. So it's natural for me to, refer them out to colleagues, to medical professionals. So I think it's a very necessary collaboration, and I think it's the way of the future, frankly.